Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Okay, so it's kind of cruise today because we have one of our great days. I was trying to let Doc know it's so good when we get patients in, outside of completely using me as a guinea pig all the time. We actually get to introduce you out there in the radio audience to people that have found their way to the Vein Clinics of Hawaii on all the islands, particularly here on Oahu. And sort of let you know, hey, I'm like that, and here's going to be today a guy who's like that. And so we're very pleased to welcome to our program a patient of the Vein Clinics of Hawaii, and his name is Fatu. Hello there, Fatu. Nice to meet you.
Morning. Hi.
It's sort of interesting, Doc, because every time we are able to actually draw on the experience of somebody that's a patient, I learn things and the audience learns things, but I think it's really cool because you learn things too.
Oh, absolutely. Yeah.
Which is kind of neat. It's like you're being graded today.
Yeah.
We not only have one report, but two reports. We can give my reports, and we give you Fatu's report. Okay, let's talk about what fortuitous series of events brought you to Vein Clinics of Hawaii. What were you concerned about?
First of all, thanks for having me on here.
It's our pleasure, believe me.
Thank you. Just the fact that I've been dealing with this for a couple of years, just the consistently having ulcers and whatnot. And, for anybody who's had it knows it's just a pain, just consistently. And we weren't getting the actual correct information from our primary care physicians. A lot of the stuff that I've learned in the past 6 months in regards to what I had would have been awesome to know earlier. Just having that wound there, and then it's the same treatment over and over. Antibiotics, they say elevate your feet and whatnot. At some point, it's like, okay, shouldn't we find a root cause of why I consistently have it? It just took a miracle of happenstance to at the Queen's Medical, the wound clinic. They just kind of told us they'll have me go see a vein doctor or whatnot, not particularly the Vein Clinic of Hawaii.
Yeah.
Something happened. We couldn't get an appointment straightened out. My wife actually just went online and found
our great website.
Exactly.
Right? Good.
And that's
so. Doc, you can actually pay the web designer. A little bit of.
We'll actually pay him this month. Yeah.
I know. And it was wonderful. I mean, the experiences since we got there has been awesome. The staff there is really great as far as working with us. Yeah. I work a full-time job and whatnot.
Sure.
And just really kind of coming in there, doing the initial prognosis and whatnot, really kind of communicating the reasons why. And it's been, as far as, like I've shared it with Doc also, it's been life-changing. It's been awesome. I mean, for those of us who have dealt with it,
sure,
we know it's night and day. So
and so Doc, maybe you can find out from Fatu what was the history of this particular thing. In other words, by the time he came to you, he really needed to get it treated.
Yeah. And I'm so appreciative when patients, don't mind coming into the radio and telling their story, because not only do we learn from that experience, but just to allow to convey that information to people that are out there. And before you were talking about some family members, even people with bad ulcerations, that don't go away, and is like you said, tremendously life altering. Ulceration is not one of those things that people typically connect with vein problems. It's not like you had a lot of varicose veins. I mean, you had swelling, you had a lot of the higher level of venous disease signs, swelling, discoloration of the skin, etc., and then ulceration. So, I think a lot of people don't know that there is potential remedies out there. But, like most people with venous disease, it usually starts with genetics. And I think you had family members.
Yeah, thanks, Grandpa, you said right earlier. Yeah, me and my grandma. Thanks, Grandma. Yeah.
I know. Just like what you said, Doc, but it's a hereditary thing. I have cousins that are dealing with the same issue, but unfortunately, they don't live in Hawaii. So I was kind of sharing with them what the treatments was, and they were kind of like amazed. It's like, oh, I thought it was just other things. And I don't know, as far as the information,
What did you mentioned that your grandfather had vein problems.
Yeah,
what did he have exactly? Do you remember?
I just remember as a kid he was in a wheelchair and whatnot. And
wow, serious.
So it's he was older too, so he had other issues also. But I know that his the circulation portion was one of it too.
Yeah, bad circulation. Yeah. Did he ever have vein stripping? Surgical vein stripping?
You know what? I just remember having a Band-Aid on his
leg. Yeah. Like, a lot of people remember I can remember my great-grandmother. She was, when she'd be sitting around the house, she always had the ace wraps, on her legs because, presumably because of swelling primarily. Yeah. But, I'm sure that she had venous disease,
Sure.
Yeah. So it usually starts out genetic, and then you came into our office I think the early part of April, but even by then you had a fairly long course of trying to deal with this thing. Yeah. And do you remember, with respect to the ulcer that you developed, do you remember what the inciting event was? Did you hurt yourself, or did it just pop up? What do you remember about that?
Yeah, usually because I've been dealing with a couple of years, it'll come back, it'll heal on its own, not fully heal, but then all it took was just a bruise of some sort, and then the skin would just open up and whatnot, left untreated with like any kind of antibiotic cream, and it just spreads out and gets larger and larger. And it's been the cause of some medical issues in regards to like being hospitalized because of it. And so, so I mean, that's something that I've been dealing with consistently for the past couple of years. So,
right.
Just out of curiosity, because I've not been hospitalized as a result of that particular thing in me. Other things, yeah, but when you went there, were you able to ask them, how am I doing, or what is it that I have? What brought you to saying I got to go to the hospital? Was it fainting? Was it?
It was
pain.
Basically was just what do you call? Got the chills, temperature, symptoms, and going in, and then them kind of realizing that I had sepsis or whatever the case was.
So this was a trip. This was a trip to the ER.
Oh yeah. I went straight from work, went home, tried to Tylenol, whatever, but just wasn't helping. Yeah. Took me to the ER, and then they held me back.
Was your at that point that you felt like you needed to go to the ER? Was your leg real red?
Yeah,
it had gotten really swollen and red. Yeah. And they told you it was infection.
Yes.
And then so they put you on antibiotics, et cetera. And we've talked about that before, where sometimes that redness sometimes it's infection. I mean, it's not like across the board, but most of the time when people develop that real intense redness, especially if for whatever reason you had developed a lot more swelling during that period of time, often it's not infection. People go to the ER or wherever, and somebody will say, well, you have cellulitis. Now, cellulitis is an infection of the skin. And often in people with venous disease, your leg can get intensely red and tender too, but often it doesn't necessarily mean that there is active infection. Now, unless they had other cultures or whatever that may have been positive, I don't know exactly what happened in your case back then, but often it's not. But people then get put in the hospital and they get started on antibiotics. But probably the most important part of their therapy is that you get put in bed and your legs are up, and the swelling starts to go down, and the whole process starts to resolve. And so
it looks pretty good. Go home.
Then they kick you out of the hospital.
Yeah.
But you're never quite sure whether it was the antibiotics that really cured you, or was it just elevation and getting rid of all that swelling.
The thing that I still want to go back on, though, because I want to prevent people from not realizing what a sign is and then getting in there. So you must have had enough experience or enough forethought to think, okay, what I've been doing to fix this ain't fixing. So I'm going there. How long were you in the hospital, in the ER?
Up until, thank God, up until this past year and last year, my wife would tease me. It's my yearly visit to the hospital.
Okay.
So
and that particular visit was about how long in length?
And about 3 weeks.
Wow.
Yeah.
Okay. And she's teasing you because every year you go to the hospital
because
of your leg.
Yeah, it's my flu season. Here's the guy I got to the hospital. Yeah.
Okay.
And that's really what it was. And so, so last year I was grateful that I didn't have to. So, and so that's why when we came to see you, Doc, I'm like, I don't foresee that going in.
The thing that I think would be of interest to the listener is that when you're there, you have a lot of chance to introspectively think, well, what am I going to yell? None of my friends are in the hospital. I'm in the hospital. What am I going to do to not do this? Was there ever a time in the very beginning, before you met Doc and before you had it treated as a venous leg ulcer, was there any relief, or was it just you got a little bit better and went home?
Yeah. Basically, it was just dealing with that particular situation, never really finding what the root cause was and whatnot. Was just, we treated you, you're better, go home, make sure you elevate your feet. I'm like, did
the ulcer actually heal during that time?
It healed.
It went away.
But knowing what I know now, I know why it healed.
Yeah.
You know what I mean?
And that's such a common scenario with people who have venous ulcers that are not being treated in the proper way. They can heal, you know, if you get rid of the swelling. If you keep your legs elevated, especially if you're using some compression, often that ulcer will go away, but invariably, as you have found out, it comes back. And like you also alluded to, you have to get to the root cause.
Okay, so Doc, maybe if you could, is now that we've figured out what brought Fatu to your office. Now, when you quote got him, when you inherited him, it was all right. Boy, this is perfect. How did you, number one, determine, if you can determine what your first diagnosis was and what you gave him as an option for a treatment plan? How did you decide to deal with this?
Well, the first thing we usually do is, after we ask all of those questions that we ask, and kind of get an idea about where in the whole spectrum of venous disease a particular patient is at. And of course, ulcers that are due to venous insufficiency are usually pretty typical in their appearance. So if somebody comes in with a venous leg ulcer, it's pretty easy to say, that's probably due to venous insufficiency. So, but the way that we verify that is to do an ultrasound, look at their venous function. Sometimes, the other problem that can potentially lead to or cause or perpetuate ulceration is a problem with arterial blood flow, blood flow going down.
From the heart down.
Yeah,
right?
from the heart down. So, often we'll also check that if there's any question. I don't recall whether we did with you. I don't think we felt like that was part of the picture. So we do the ultrasound and we figure out what's going on. Treating the problems that Fatu had, it's pretty rewarding because what the problem is.
Sure. And
then you define it, and then you come up with a treatment program, and 9 times out of 10, it works. It's a nice feeling. Not only for the patient, for us, but for us too.
Yeah, and that's what I wanted to make sure that Fatu was able to let you know. Because I know that there's lots of you out there, like him and like I was, that are just sitting there accepting this thing that doesn't seem to be going away. And then I guess maybe it becomes routine. And then due to some people, Fatu can't believe how long some of us have let something go before we got it treated. You said it was years.
Yeah, it was.
That's
years.
A long time.
And it was typical. I mean, I don't know if it's the lack of knowing or whatever the case is, but none of this information was shared until this past year. Like I shared with Doc, the process of me going in, getting the initial check and whatnot, and then on the day that I did do the check, I had just healed from a previous ulcer. So I went to do the inspection or the first initial, and one of the doctors there said, "Oh, it's going to open up again." And I kind of chuckled because I was like, "Yeah, I know. Yeah, it goes and comes back." But sure enough, like a fortune teller, the day of my first treatment, it had come back the previous 4 days before that. And it opened up.
You know, let me ask you this, because I would think that Fatu and me and many of your patients are the same, is that when you diagnose it and start treating it and you get the results, then the next step is to try and educate the person of the steps that they can be to be proactive to minimize it coming back. Maybe, if not at all, certainly not quickly.
Right. And that does that requires some follow up, and also for the patient to, make some lifestyle changes. For instance, most people with fairly advanced venous insufficiency, you're always going to struggle. Even after we treat you for the problems that we see, you probably are always going to struggle in one way or another with chronic swelling. And I tell everybody chronic swelling is like that's at all cost. Ward off swelling. And so compression stockings are probably going to be a part of your routine. And people ask, well, do I need to wear stockings? And I mean, even people with not terribly advanced venous disease, I recommend that people wear, some sort of compression. If nowhere else than at work, I think that's always a very good routine to do, is to get in the routine of wearing some kind of compression. It can be just knee high, but while you're at work.
Yeah, and by the way, many of you that regular listeners of our program know that I fought that kicking and screaming, and now that I've been doing it for a while and not treating it like a sock, but treating it as a medical device, the proof is at the pudding, because there's nothing better feeling than taking them off. Right at the end of the day, I'm taking these off now, going to bed. But during the day, I want to know if you've been able to do it, and because you said that you're active at work, you got to move around. That if that helps. Oh yeah, most definitely.
But for me, I actually because for those of you who do put on stockings, it can be a challenge. Yeah. So I actually will take them off when I get home. Right before bed, I put them on and I elevate and I sleep with them on. So when I get up in the morning, I just go. Yeah. And it works for me. It might not work for everybody, but I've gotten.
Should I give Fatu and everybody listening my secret?
Sure.
There are these gloves that you can get. Doc's going to be having them, made by a company called Sigvaris, which is the sock maker. And it looks like kitchen scrub gloves.
Oh, yeah.
But on the fingers, there's knobs. And you put the sock on, and that bugger goes right up. So and I actually think that, Doc, you've convinced not just me, but many of your patients, is look, for the inconvenience that ought to get them on, your ability to do stuff that you want for the day is because you're wearing those things.
Yeah. That, and also just to avoid, progressive problems in the future, for myself, I wear, knee-high compression stockings all the time at work. And the good thing about stockings, and you're right, they're not socks. It's a medical device. But luckily nowadays there's plenty of different styles, and there's different companies, and so there's a pretty wide assortment of socks that you can get that are going to fit into your lifestyle.
And by the way, now they've crept into athletics, because a lot of these guys are using neon-colored socks like ours, but they're using them on bike rides and to enhance their ability to recover.
Right.
But that being said, and I do know this, and certainly if you're just joining us, Fatu is a patient of Dr. Julips and Vein Clinics of Hawaii, and if you want to see what we're talking about and how debilitating these can be, not just embarrassing looking or anything, but how they can actually make you feel like you can't do this or you can't do that. You go and look at that website. veinclinicsofhawaii.com. And when you see those pictures, those are not 1 in a million. Those are typical of what people can get, right?
Right. Yeah, it's pretty common. It's a very common problem. You know, venous insufficiency in and of itself is a very common problem. Nearly 50% of adults in this country have some amount of venous insufficiency. Now, do all of those people ultimately go on to develop venous ulcers? No, it's luckily the minority. But, there's plenty of people out there that have ulcers and, they're not sure what they're from. Just like your, situation, Fatu. And
okay, so where we are, if you're just joining us, is Fatu went through this irritation of having this concern for a long time. Eventually, and thank goodness that there are physicians that will say, you know what, you need to go to a vein guy. And he was at the wound care clinic at Queens, and the initial setup with a vein guy that he was going to try there was a problem with it. So he ended up, doing the research, and his wife found Vein Clinics of Hawaii on the internet, and the rest is history. But when you walked in there, obviously it was a leap of faith. You said, okay, I'm going to do what these guys said. Tell me what happened when you got there, what you felt like as the first-time patient walking into the place.
Oh, it was great. They have a really good staff there. They really walked me through the process. The comfort level was really there, just to kind of describe what to expect and whatnot. They gave you all the information that you needed, and that's all you can ask for. Is just let me know what I'm looking into. And
okay, so when was that? What are we talking about here in time, Doc?
When Fatu came to our office?
When was your first
April
of?
I think early
April
April
this year. April this year. Yeah.
So as far as the patient list, he's relatively a new patient.
Relatively, yeah.
And he seems happy. So something's going on that's good, right? So talk about what you did. First of all, Fatu, did you have to answer that 5,000 question thing on the iPad like I did?
Yeah.
Okay. Now, once you got that, Doc, in your first, I'm talking about the original consult, how you all connected and how you explained the options available for Fatu to deal with this concern.
Mm-hmm. Well, after we got the result of the ultrasound. And I apologize that I don't remember exactly what we did.
Well, you do you have a few patients.
But I think that Fatu's problem was primarily superficial venous reflux. I don't think that because when we evaluate patients, it's always one of the questions: is it just the superficial venous system? Or is it the deep venous system, too? We've talked about that. And I think Fatu is primarily a superficial venous system. And so in that case, we do something called endovenous ablation. And typically, if a vein is not functioning,
gotta go.
Basically, we close it down, and everybody says, "Whoa, you close it down." And I say, they always say, "Am I going to be okay?
Am I going to run out of these things?"
Run out.
We all ask that.
Yeah. But the bottom line is that if a vein like that is not functioning, it's not doing you any favors. As a matter of fact, it's working against you. There's a variety of different ways that we close the vein down. And then after we close the vein, then the body redirects the blood that would otherwise be going through that vein into veins that are going to take it up in the right direction, which is upward toward the heart. But with respect to what are the different procedures and techniques that we use to do endovenous ablation, a little depends on which vein it is we're treating, and the size and location, and et cetera, et cetera. There's a number of different ways that we do that these days.
The reason I asked the question, and Fatu can join in anytime you want, is that I thought to myself, all right, you have to treat the ulcer before you treat the vein, right? I mean, there's an order in which you do. You got to fix this thing so you can go and do the other thing. So what I'm guessing is that if you have these conditions of your veins and you're, right under the surface there, that you're going to have to, in anticipation of them becoming ulceric someday, get rid of a bunch of them.
Well, with respect to what you first said, do we need to get the ulcer healed before we treat their venous insufficiency? No, not necessarily.
I can answer that.
Yeah.
real quick, like
go ahead.
The first day of my treatment, I actually had the ulcer came back. So it came back. So I distinctly remember Doc saying, "Oh, this is going to help your healing process." So I was like, "Okay, cool." So when he did it, when I completed the treatment for my left leg, mind you, it usually takes a couple weeks. The last ulcer that was there for about 6.5 weeks before it healed. When I went back to the wound clinic a week and a half later, it was like 5-6 days later, they opened it up and said, "Oh, it healed."
Okay, was that because you got out what was behind that thing, Doc? Is that what happened?
Well, we in closing off those veins, again, the problem is that in the veins that aren't working properly, the blood flow is going in the wrong direction. It's going downward, and with that downward, flow of blood, it also creates an increased pressure within the venous system, and it's really that pressure that then ultimately leads to skin changes because of the biochemical kind of things that are going on, and then also specifically for the skin to then ultimately break down and create a chronic ulcer. So we have to do, when we close those veins, what we're doing is we're getting the blood to redirect, but as importantly, we're relieving that venous pressure, that we call that venous hypertension. And when we get rid of that, abnormal increase in pressure in the venous system, that's what then allows the swelling to recede and for the skin to get healthier again and for the ulcer to heal. Basically, we're treating the skin.
Yeah.
The skin is sort of the end organ.
Interesting, though, because I'm guessing, Fatu, that maybe you could say, okay, well, it was nice to know the hole's going to go away, that I'm going to be cured. But what about the rest of, use of the leg, better feeling, less symptoms?
Oh, yeah, most definitely. I shared with Doc last week, and I told her, I even tell my wife because nobody really knows what the treatment is. So I've been sharing it with friends and family. So they're asking, so what exactly are they doing? It's like, I explained the veins and everything. And the best way I could explain to them was prior to me getting the treatment, I always felt like I was walking around with weights on my ankles.
Yeah.
It always felt heavy. So when my left leg was completed, that doesn't exist anymore for my left leg.
You know what, Doc? We've talked about this, and me and other patients, that some people say it's heavy, some people say it's tingly, some people say it's numb, some people say it's hot, some people say it's cold, and it's the same problem. Isn't that interesting how we tend to say it's heavy?
I think that probably some of those are actually different symptoms. But for instance, when you say pain, I mean, pain means a whole lot of different things to as many people as you ask. It's a little different, but pain and numbness, tingling, all those sorts of things, I think are kind of like in one category. But often, in a very very common symptom of venous insufficiency is heaviness, and that sort of goes along with fatigue. So we always ask that question. Do your legs feel heavy? Do you feel like your legs get tired quicker than they used to or quicker than they should be getting? And, after we treat people, the heaviness goes away. They feel more energetic. Their legs don't tire as quickly as they used to.
I started doing Zumba with my wife.
Yeah, there you go. There's another thing that I wanted to ask about that physical activity.
Yeah.
I think that we normally, everybody out there listening, you normally elevate your legs when your back is sore, your legs are sore. Yeah. Did you do that?
Oh, yeah.
Yeah.
But I think I'm more aware of it now.
Yeah.
Like I kind of understand like what Doc said. I realize that the treatment itself is life-changing and whatnot, but I still got to do my part in keeping my feet elevated.
Maintenance.
Maintenance.
And unfortunately, the stockings.
Right.
But, I actually, I'm so glad now because when I put them on, the moment you put them on, you feel like, okay, now I can go to do all my stuff today. I'm not going to worry about my legs.
Yeah. What were some of the things that you back when you were struggling for such a long time with this ulcer, coming and going, what were some of the things that you were not able to do because of that? I mean, I assume that you continued to work through that whole time, right?
It was just times it was a struggle to walk. Like, I always laugh about it with my friends and whatnot. You're getting old when you got to navigate a curb.
Yeah.
You know what I mean? And it's just, I had to really kind of be aware of when I'm walking because I wasn't really picking up my feet.
Yeah.
It's just so little things like you normally kind of trip on stuff. So, but it's been amazing. Like just the one leg. So,
Yeah.
Well, I know, Doctor, that's the kind of result you need, and that's the kind of result that patients expect. But when it happens, talk about maybe the returning spiral of activity that you've noticed in other patients that are able to get back and do more things like. Maybe they used to play golf, haven't played golf for 10 years and wouldn't shut around to golf.
Yeah. Well, we hear that all the time. People really get to the point where they have limited their activity, and it starts to impact their general health otherwise, because they say, gee, I just can't, I don't feel like I can go to the gym anymore. I can't take a walk. I can't play with the grandkids, and it can really, limit your activities, affecting your quality of life as well as your general health.
Have you done, Fatu, some goal setting?
No, yeah.
That's the cool part, isn't it?
And that's what it is because you see, like, for those who don't struggle with it, just simple stuff like that, and now you can kind of. You have goals.
Hey, let me ask you this too, because Doc and I, we often snicker at this when we're doing other programs. Is that I find myself out in the public now noticing things on other people that I didn't used to notice.
Yeah,
And I go, poor bugger, he's got a leg ulcer. Oh,
I know. No, what's funny is when you go into Doc's office, he has pictures. He has pictures in there.
Yeah.
And my 7-year-old was sitting there and goes,
"Hey,
Dad,
Papa, that's your knee."
My 7-year-old, "Hey, Dad, is that your leg?"
That's
my leg.
Great. But I think that what happens is that you need to develop that sense of gamesmanship. That, okay, if I'm willing to put this thing on, what's it going to do for me? And you talk about that, and I Fatu's probably like me thinking, you're a regular, normal guy. What are you putting those things on for? Well, because you don't want to have a problem, right? Yeah.
Well,
you're up front of it.
Yeah. Well, yes. Yeah. Sure. Yeah. I don't want to have a problem, but just because they make your legs feel so much better at the end of the day. I mean, if I'm on my feet all day long and I don't have compression stockings on, my legs feel lousy.
Well, one of the things, Fatu, that we've talked about before are some of the professions that some of our patients and some of our folks on the show have been, whether they be cooks, or whether they be in retail standing up or security or whatever, that, if all of a sudden you can't take the overtime shift because you don't have it, you're penalizing your lifestyle, right? Or your enjoyment of life.
Yeah. You've worked on. Have you worked on your feet most of your life? Would you say?
Oh yeah, most of my life I've been on my feet.
Yeah, and that's one of those things that increases your risk of developing venous insufficiency, and we see a lot of people like that who have occupations where they just have to be on their feet all day long.
Oh yeah.
So we end up treating a lot of nurses, teachers, hairdressers.
Oh, everybody. Listen, we often use as analogies, Fatu, on this program, a dentist. Because there's a guy that's standing up all day, no matter what it is. And you think, gee, that guy, poor guy. Well, that means if you have to have one less patient a day or, you're able to work one less hour a day, it's affecting your livelihood as well as your comfort.
Right. Mm-hmm. Yeah, quality of life and income. Sure.
Okay, so that people know, when you first started with Fatu looking at doing the treatment, I was incorrect. You went ahead and started dealing with the venous part of it right away.
Yeah. Getting back to that, it's not like we have to get an ulcer healed. Now, sometimes, depending on the location or whatever, sometimes we work at getting it at least partially healed so that we can do, the type of procedure that we want to do. But by and large, it's not necessary. Now, that being said, however, we are treating their venous disease. We do a little bit of wound care, direct wound care in our office also, but most of the time when we're in the process of treating somebody who's had a chronic ulcer, and especially if they've already been connected with a wound care clinic the way Fatu was at Queens, they will continue to be treated in that wound care clinic. So coincidentally, now obviously luckily your ulcer healed quickly and they booted you out of there.
They booted you out. But you know what? Maybe you can explain at the way they reacted when you went back in after you had the venous treatment. But they must have said, "Whoa, this is great."
Yeah, they because I went to see them the same day of my first treatment. I saw them in the morning, and my treatment was in the afternoon.
Yeah.
So when I went, they wrapped it like normal, and they said, "Oh, see the wound care clinic, and then we'll schedule you for the following week." So I went to see them, and then we went through the whole process. Then my appointment was 7 days later. When I went back, they said, "Oh, it's healing," and that was, you know what I mean? That was crazy. Like I was like, "Oh, what?" And, I couldn't. So they just covered it one more day. They just told me, because I told them I had an appointment later on again. So usually what the treatment is for anybody who's been to wound care, they wrap your whole foot, from the bottom of your foot all the way to your knee. This one, they didn't wrap. They just put a Band-Aid on it and
out you go, man.
And let me put the stocking back on. So I knew then that, oh, okay. So I just went one more appointment back. When I went back, they said, "Oh, you don't need to come back. It's already healed."
You know, Dr. Julev, maybe you can explain a little bit at what seemingly a real proliferation of these places that didn't used to be anywhere. I mean, now I don't want to say it's fashionable, but a real niche has been developed for wound care.
Right.
And it must be for cases earlier in the piece that you don't know quite exactly what it is yet, but it needs to be healed.
Yeah. That's
Exactly
right.
In other words, it seems to me that these places are, instead of keeping somebody in there indefinitely for wound treatment, they're starting to refer people out to the right place they can be to get that specific wound fixed.
Yeah. I think in the past, before wound care clinics were as accessible as they are right now, there were a lot of people that were sort of lost in their care, kind of what Fatu you described kind of early on. Your family doctor was kind of treating you, but, wasn't really hitting, getting you to the spot where you needed to get to. Before wound care clinics, there were a lot of people that were sort of like, out there and having recurrent ulcers and, getting nowhere fast. The good thing about wound care clinics is that's all they focus on. Their complete focus is on that wound, and what do they need to do to get it healed. But they're locally treating it. They're doing what we call debridement, getting rid of necrotic dead tissue, using topical kinds of things, and wraps are very, very important. Again, those wraps are meant to eliminate as much swelling in your leg and in your skin as much as possible to get that skin healthy again. I think it's been a tremendous benefit, and we work with all of them all the time.
Sure. Yeah, and I think another thing maybe, Fatu, would be important is several times, you mentioned in passing, mostly humorously, about your wife. Let's talk about support system and maybe the kind of help that you can get when somebody is knowing that you're on the right path and that maybe you're willing to do a little bit on your end of things to make sure this happened, because nobody wants to have that annual trip to the hospital.
And it's like what we talked about earlier about the affecting of your personal life and whatnot. That takes effect too, because the consistent going to the doctors and whatnot, and the annual trip to the emergency room. That's not fair to my wife to deal with that on a regular basis. So, just her taking point on it and trying to get me better is whatnot is. You really need that support system, just to really kind of push you to remember, put in your stockings.
Yeah, and I'm wondering, and knock on wood, I do too have that support system. I think it would be key to somebody's, success is to have that complete support. But also, isn't it healthy when somebody? Isn't it terrific when somebody will notice a change? Saying, "Hey, you got more energy, huh?" Or, "Gee, that thing's looking pretty good." It must make you feel, in many respects, that, oh, for heaven's sakes, I'm on the right trail. This is the place I need to be.
Most definitely, Just the simple. Like my wife always says, "Oh, look, honey, you have an ankle again." Just laugh about it.
We were just talking about that earlier. Hey, wait a minute. I knew I had an ankle in there somewhere.
Right. Yeah, there's a definite cost to having an ulcer that just will not heal and is problematic, even if it's on and off and on fashion. But look at the number of hours in a day that you were probably spending tending to the ulcer.
Yeah, somehow worried about that thing.
And look at the amount of money that you paid probably out of your pocket to deal with dressings and all of that sort of stuff. And when you look at now, you multiply that by everybody in the country, and there are billions of dollars being spent. Billions of healthcare dollars,
which are not curing that ulcer.
Exactly. And those if people were to be able to identify that there is a root cause and kind of make it to the right place, there'd be a lot of dollars saved in our healthcare system.
Yeah.
So it's a very, very expensive proposition.
Yeah, one more thing, too, I think, or many more things, Fatu, but this is, I had trouble understanding it myself and explaining it to others, because this looks like an open wound, and yet it didn't really bleed.
Yeah,
you know
exactly.
what I mean? And I was always wondering, this is blood, isn't it? How come it's not leaking out every day?
Yeah.
Well, Doc, you explained that to me, because it is. It looks like it should be painful and bleeding, but the pain is not there; it's somewhere else. And
I didn't even know it was called an ulcer. I just thought it was like, I have a cut.
Right. Yeah. We use that word ulcer for a lot of different things, but it just means that there is a breakdown of the skin.
Well, I got to tell you, gang, we do this on a lot of programs, and every time I ask Doc the question, he answers it the same way, because it is. An ulcer is a hole. And I mean, everybody thought, I bet, I'm pretty sure, Fatu, you thought this. I thought, well, what do you mean ulcer? I thought that's what you had in your stomach. You know, that's a peptic ulcer from eating too many hot dogs. No. An ulcer is a hole.
Yeah, my wife always said, you have a hole in your foot.
Yeah. Stop calling it an ulcer. But I think maybe that it gets labeled that way, Doc, is pretty healthy, because now sometimes there must be other people communicating with you, and if a person like any patient like me, or if Fatu goes on vacation, if you go somewhere else, and if you had to visit somebody, knowing these things is pretty paramount of getting it healed right away.
Sure. Yeah, and our records are accessible, and being able to describe, where you were at when you first came to us. There's a variety of different ways that we do that, and we use specific terms, and it would definitely help, or it definitely helps with the transmission of that information from one physician to another, one office to another, et cetera. So make sure everybody's on the same page, and we communicate in a similar fashion with wound care clinics. I mean, because they kind of know the lingo too, and everybody's on the same page.
Now, in the last time you mentioned earlier that you had almost an annual pilgrimage to the hospital, and it maybe is because it takes a long time. Doc, you can explain why these things, your body can handle it for a while, but after a while you just don't have the ability to handle it, so it gets worse.
Well, I think it's that, but also it's a cyclical kind of thing, and I think what happens probably is that people develop an ulcer, and then after they've had to tend with it for a while, they kind of start to recognize it's getting worse. I need to do something more about this. So they seek help in one way or another, and they get a little more conscientious about elevating their legs or wearing stockings if they do. Maybe going to a wound care clinic, doing extra things to get the ulcer healed, and it will. Often it will.
Nice to take that clinic off your list, though, right? That's another place I don't have to go to for a while.
Yeah, exactly.
But then then it heals again, and you lose. I mean, it's natural. You lose the motivation to do those extra things that got the thing healed to begin with, and then the skin breaks down. So it's kind of a cyclical sort of thing, because again, the underlying cause has not been addressed.
Fatu, are you more likely, do you think, if you see a little hole somewhere, saying, "Hey, I wonder if this is one of those things. I'm going to go get this looked at." Have that happened yet?
As far as the awareness part is concerned, like, I know for a fact now that the elevation and the compression is the key to approaching that. So if something does come up like that, I'm more aware of it, and
I would imagine that I'm like looking. Do I have a hole? Do I have one of these ulcers?
But that's the thing, is like what Doc said, is like the awareness is so much more keen and knowing what to stop it with is the compression.
Right.
Doc, let me ask you this, because I think there's a lot of listeners out there that will be thinking this. These venous ulcers that we're talking about, where are they most likely to occur? If somebody's at home right now with a hole that hasn't healed for a while, where is it likely to be that you can attribute it to probably being a venous ulcer?
Well, it's location and it's also appearance. So, typically venous ulcers occur at the lower part of the calf, often in the area of the ankle, but they can come up a fair bit onto the calf, in advanced forms. But the ulcer is said to be irregular. It has an irregular border. Now we say irregular border because that's in opposition to arterial ulcers, which are a little more
round,
more discreet,
right?
and punch out. And have a very specific appearance. And most of the time, when somebody comes in with an ulcer, we can say, "Oh, gee, that's venous. That might be arterial." There's also something called diabetic ulcers.
Yeah, I was going to ask you. And as a former type 2 diabetic myself, and I know a lot of people that are on that. Sometimes they'll get something with their foot that they think is a venous ulcer, or they think it's not. It's a diabetic ulcer. Do they look the same?
No, they look very different.
Okay.
So, diabetic ulcers typically are on the bottom of the foot, on the sole, in pressure point areas. And part of that is because of the fact that many people with diabetes have neuropathy, and they have
can't feel it, right?
Can't feel if there is something like they have something in their shoe, and all of a sudden it's there all day. They don't know, and before you know, you've got skin breakdown that ultimately turns into an ulcer. But it's funny how very typical each form of ulcer is, and it's pretty easy to identify. With venous insufficiency and venous ulcers of the lower leg, we talk about the gaiter area. We've talked about that before, and that's kind of the inner side of the lower leg, just above the ankle. In moving up the calf, and that's probably the most common area for a venous ulcer.
Naturally, that's where I have one right now. I'm a little puka that we're dealing with today, as a matter of fact, a little later on.
Yeah.
But it's tremendously interesting, because I think that it's become a science of wanting to know what my body is doing today, and maybe what I got to do about it. So I must be, in that you have been willing to share this with other relatives that have similar conditions. Are any of them doing anything about it yet? Kind of early?
Yeah, it's too early. Trying to share with them, and just let them know that there is actually help out there.
Yeah.
Just to give them a call. A lot of it, I just tell them, hey, just go see them. See what they tell you. It can't hurt. Just to get some.
Yeah, right. Well, that's a good point. Yeah. It's not like we're going to tie anybody down and make them do anything they don't want. But at the very least, your family, they should find a good quality vein clinic and at least go in and learn about what's going on. I mean, look at how much you've learned just over a very short period of time.
I send them to you because your office has the best view of any doctor's
office. I noticed that too. It's up there yesterday saying, "Hey, this is extra. You got to pay extra." But what I think is more interesting is that I hate being doom and gloom. I like to be proactive and active in something and saying, you know what, I was able to do that because I did this. So every little tiny victory is important. But I also guess, Doc, that there are many, many times when the referrals that you get from your family practitioner still aren't happening everywhere they should. So that it means that if nobody needs to check with any specific doctor that they're going to go see another one. But it is like in my case, the doctor recommended me, and you feel a lot better. You feel that this guy is willing to pass me along, and he doesn't get anything. He's not getting a commission for Dr. Jewell if he's sending a patient over somewhere else.
Right. And unfortunately, though, some insurance programs do require a referral. Is half do, half don't. But that's typically something that we can kind of work our way through. I think the important thing is for individual people to understand that, gee, they might have a problem, and if they think they do, then just give us a call, and we can kind of, if it's something that we can't help you with, we'll talk to you for a few minutes, and we'll figure out where you should go.
And that's VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com. You must feel pretty good, actually, Fatu, after being at the wound clinic, that somebody there was smart enough to realize that, you know what we're doing here is great. We know we can heal this guy, but it looks like it might be one of these, so let's send him along down the line.
Oh, yeah, and that was the first time ever, like, in the history of dealing with this, where they actually kind of had an idea of where to what direction to point me.
Well, the first time that it happened was about how many years ago?
5 years ago.
Okay. Yeah. Were the Vein Clinic, was the wound center already open then?
No, I think they're.
Yeah, I remember, Doc, you said this is kind of relevant. So it wasn't even looked at venously the first time.
No, it wasn't even. It was just deal with it, heal
the infection. Right?
Wow. Kind of approach kind of locally, just at the level of the skin.
Well, aren't we very, very liable, Doc, for multiple conditions? If you got one that's so sidewards, that means that you have health issues. That must mean there's other little heebie-jeebies waiting around to jump in and do their thing, whether it be heart or whether it be lung or whether it be whatever.
Yeah. Sure. Yeah. Things often go along with one another, but and we try to sort that out too. If there are other medical conditions that are impacting what we're doing. We try to get the people to the right place.
Is it a blessing? I mean, I already know the answer because of the time that you've spent in the wound clinics. But this must be, not only is it a growing part of medicine specialty, but it looks like it's filled a niche that just was pretty much ignored before that.
Yeah, and I think that's why that whole field has sort of blossomed, because it was a niche that wasn't being fulfilled, and there's a lot of need for that. Yeah. There's a tremendous need, and that's why they've grown so rapidly.
Fatu, I'm sort of recreating as I go along a new bucket list. There must be some things that we're not able to or not comfortable doing for a while that you're now thinking of doing again. Any?
Just wearing shorts out in public.
Yeah, there you go. That'd be nice. Yeah.
You know what I mean? Like, the only time you'd ever see me in pants is in work.
Yeah.
And I was like, so just those simple things,
But simple things mean a lot, don't they, Doc?
Yeah.
Oh, yeah. So, but being able to get up and around her easier.
Yeah, I mean, that's, I have a high threshold for pain myself. That's not my wife, but just it's the consistent battle of trying to go through that. And,
sure.
And now I see a light at the end of the tunnel with the treatment.
Yeah, and I think that's one of the main reasons why, Doc, we are so blessed to have so many of your patients willing to come down and share, because, as you know, a lot of the patients that we've had in the past with other conditions, polar opposite of what is or was going on with Fatu, and the fact that now seeing one of these coming, it's likely, if it does come back, which you said it has a propensity to do that, that you can get it treated a lot quicker and go through a lot less, long-term symptoms.
Yeah. Well, now that we've treated his venous insufficiency, I think that should lessen the recurrence quite a bit. I mean, it should almost be zero. But again, swelling is something that you're going to have to deal with or contend with.
Oh yeah.
For probably the rest of your life, and controlling that is going to be a huge step.
At least I know.
Yeah.
You know what I mean?
Yeah.
Like, prior
That's
to
the
me,
key. Yeah.
Prior to me showing there was I never was ever told compressors always elevate your feet.
Yeah.
Okay, but at least I know now, and it's just the awareness is there.
Thank you so much for spending some time with us today. We really appreciate it. Wish you ongoing success in the battles that you're going to get back in and stay in health. And for those of you that want to know more, go to VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com. And like Fatu, make an appointment. Come down, see the doc, and see what's going on. We'll see you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, VeinClinicsOfHawaii.com. That's VeinClinicsOfHawaii.com.